And Jared and Jacob join us this morning for Health Monday from Marble City Pharmacy, a monthly feature here on Daybreak Live. And I just want you to know that I did recover from that school crud.
We were really concerned about that.
That was the sickest I'd been. I mean, I was really sick for 3 or 4 days with that, and it was awful.
Well, now that school has started back, we really do have sickness all over the place. You can always tell when school starts back at the pharmacy. Even if you didn't know when school started back, you can tell because the pediatricians are a lot more busy, the pharmacy's a lot more busy.
Even for old folks like me?
Yeah, listen, the kids go to school, they pass it around, then they come see you at church and everywhere else, and now all of a sudden you're Star Student of the Month. Maybe bringing a bug.
Hey, flu season is upon us.
It is. Unfortunately, it is. Like Jared mentioned earlier, we had a child come in this past week already testing positive for the flu. And so flu season is rapidly approaching, if not on us. And more importantly, for what we want to talk about today, flu shot season is upon us because of that. And so that's where we want to go today.
Is there a calendar year time for when flu season starts?
Yeah, there actually is. Flu season, generally speaking, each year is between October and March. It's heaviest in January and February. That's when we see the most flu. But it can start as early as the 1st of October, and I'm talking about heavy cases. Yeah. Like Jacob said, we've already had 1 positive test. We'll have some more in the next few weeks. But we usually don't have any outbreaks until at least the 1st of October. However, that means we need to be getting flu shots right now.
How do you get the flu, by the way?
That is a good question. You get the flu, real simple, you get the flu from people that have the flu. Now, however, how that generally transmits is from particles from coughing and sneezing. You cough or sneeze, you get some on your hands, you touch a doorknob, or you cough and sneeze and you're in a room with someone else and it's in the air. It's really easy to transmit. It's a very transmittable virus. It is a virus, by the way. It's not a bacteria. It's a virus. It's easy to transmit because you get it, you're going to cough, you're going to sneeze. So it's in the air. It's on your hands. It's on your clothes. You touch stuff. It stays on surfaces for a couple of days. I mean, it's there, and so it's very easy to get. And so hand contact, being in the presence of someone coughing and sneezing, it's very easy.
Now, you guys last year talked me into taking the flu shot. First time I'd ever taken a flu shot.
And he's still here today.
And it worked well. When I was sick last week, first time I'd really been sick all year. And the symptoms I had may have been similar to the flu. What are some of the symptoms?
Oh, they may have been. Generally speaking, with the flu, you'll have things like runny nose, nasal congestion, cough. The thing that almost sounds like a common cold, though, doesn't it? The thing that usually separates the flu from a common cold is that along with those things, you'll have body aches. Sometimes people who have the flu describe it as they literally feel like they've been beaten with a baseball bat. And many times people have a difficult time getting out of the bed. And sometimes this will last from 7 to 10 to even 14 days. And so it can be very difficult on a person. Missed days of work. It sounds like you missed some days just recently. And I'm glad you brought that up because last season's flu shot, which we were successful in getting him to take, very, very proud of that.
It's our greatest achievement.
That's right. Last season's flu shot, as it's been almost a year, is not really effective right now. If there are strains of the flu circulating right now, they're different than what was in the shot from last year. So that's important to remember.
Wow. My wife got this medicine is called Mucinex. And if I'm lying, I'm dying. That pill was that long. He almost had a plunger to get that thing down. And I'm telling you,
it's a scary mental image.
Yeah.
I didn't need
flu
that.
can be very serious.
It can be very serious. And every year it's very different. And so the best way we know to tell people is that our CDC, the Centers for Disease Control, they generalize it. They look over, periods of 10 years, 20 years, 30 years, last year, and they correlate all this data. And what we can say with confidence, although the numbers vary a little, is every single year in the United States, millions will get the flu. Hundreds of thousands will be hospitalized because of the flu. And tens of thousands will die from the flu and or its complications every year. And again, the reason being...
In the United States?
In the United States. Every single flu season, so October to March, tens of thousands of people in this country are going to die from the flu and or its complications, which often it can, especially in people more susceptible, can turn into pneumonia, things like that. And so the flu directly or indirectly leads to tens of thousands of deaths every single year in this country.
Jared, is it the more fragile people that are more susceptible to flu-like symptoms and
It
stuff?
is, absolutely. We've said this for other conditions on this show, but this won't surprise you. People who are over age 65 are the most susceptible to the flu. They have more hospitalizations. They have more cases that turn into pneumonia. They certainly have more deaths. You have your little children. First of all, you got your kids who are less than 6 months old who are too young to get a flu shot. You got your young kids who are still developing, right? Their immune systems and such, so they're more susceptible. And then besides the very young and the older, you have three main categories of people who are most susceptible to serious complications. That would be people with heart disease, people with lung disease, and people with diabetes. These are groups of people who just have a more difficult time beating the infection back, and sometimes it can overtake them.
Well, I'm assuming that the best way to prevent the flu is to get the flu shot, and you mentioned changes in the flu shot this year.
Yes, every single year. What our government and the people who are way smarter than anybody in this room, no offense, do is they look at patterns of what flu strains are circulating in other countries that typically move this direction. And so they start prepping months in advance. This is what we anticipate seeing. They make a new flu shot every year as best they can predict scientifically, most directed at what we're going to see flu strains this year. And so that is the number one way to prevent having the flu. Now, there are other things that we all need to do. If you've got it, kind of seclude yourself. Don't be around everybody. Don't be at church huffing in everybody's face. Cover your nose and mouth when you cough and sneeze. Wash your hands. Everyone, prevent it. Wash your hands. If you have to take care of somebody's got it, wear a mask. Things like that. But the number one way, hands down, is to get the flu shot each year. Not, I got it 2 years ago, so I'm still good. I got it 3 years ago. No, every single year we have new strains. You need to get a new flu shot.
You think, Jared, that mentioned tens of thousands of people lost their lives last year and will lose their lives this year. Sure. I wonder if there's any studies been done about how many of those people took a flu shot.
Oh yeah, I think there have been, and here's the thing. What they found definitively is that in persons that have flu shots, their risk of dying is manyfold. Manyfold, is that a word?
Go manifold.
How about
manifold? Go manifold.
Many times less is what I'm trying to say.
I got you.
Yeah. Many times less. And what they found with the flu shot is that that it doesn't prevent 100% of cases of the flu, right? Because here's what happens. This is a prediction, as Jacob said. The CDC, the World Health Organization, all these people are getting together to decide what's in the flu shot. They're predicting the strains that are going to be circulating in the United States during this flu season. And so there may be strains that are different than what's in the vaccine, right? And so a person may get the flu after having the flu shot, but studies have shown definitively that those people get less sick than those people who did not have the flu shot. So the question of whether the flu shot saves lives has been answered many times over by studies. It most definitely is a lifesaver.
Wow.
Numbers that have been released. They haven't released last season's flu numbers yet. That won't be till later this month. But so two flu seasons ago in the United States, right at just under 200 children died. Again, so if tens of thousands are going to die, it's mostly older folks. But right around 200 children died. 80% of those no flu shot. And so there's your numbers of those that die, at least in the children population. I don't know if this extrapolates into the elderly, but of the ones that die, 80% didn't have the flu shot.
Why do you look at me when you say older folks? Is there a particular reason for that?
Sometimes your mind just goes somewhere whether you intend for it to or not.
Well, certainly people like myself need to be at the front of the line to get the flu shot. Who else?
Need to be at the front of the line, yeah. So persons over age 65, actually, let me just back up. The CDC recommends that every single person over age 6 months gets a flu shot. That's pretty simple, right?
Yeah. Unless
Easy
you're
to
less
remember.
than 6 months old.
Unless you're less than 6 months, you need a flu shot. That includes people who are pregnant. It is not a contraindication for the flu shot for pregnant. In fact, it's a reason to get the flu shot. You can have serious complications with the pregnancy for both the mom and the baby if you get the flu while pregnant. But people over age 65, people, as we mentioned before, with heart disease, any kind of lung disease or diabetes, and really everybody. Everybody who comes in contact with someone else.
That's a pretty broad brush right there.
So if you're really successful at being a hermit, maybe you don't need one.
Yeah.
But other than that,
That's right. That's right.
You know, there are myths concerning the flu shot, and I succumbed to some of those myths down through the years. And you know, I didn't take the flu shot, and I was sick 4 or 5 times during the flu season. But I didn't take the flu shot. It didn't make me sick, Spike Rankin.
all right, so
Congratulations.
you did a good job. Now, 2 myths we need to address. The first is taking the flu shot can give me the flu. That is 100% scientifically impossible. It is a dead virus. It cannot give you the flu. Now, if I get my shot, might I feel a little off the next day or two? Might I have, sniffles or something? Yes, that is just an immunization reaction. Mm-hmm. That is not the flu, and it is not getting the flu. So it cannot give you the flu. Myth number 1. Myth number 2, if I'm a healthy 30-year-old, I don't need to get the flu shot. I've had the flu before. It's not going to kill me. I'm a healthy 30-year-old. Now, you're correct in everything. All that's correct. It's probably not going to kill you if you're a healthy 30-year-old. However, if you have a grandmother or a child or a niece or a nephew, or if you go to church, or if you go to Walmart or the grocery store, there's people you're coming in contact with that it is a big deal for. Yeah.
That's right.
So, I mean, just for the humanitarian aspect of it, if you're going to be around people over 65 or children, or if you're going to be in wide public places, which is, again, pretty much everybody, it's not always just about the individual. Yeah, at 30, you're going to live through the flu. If you get the flu, you'll be fine more than likely. You'll just be miserable for a week or 2. But for others involved too, if you have family members, things you care about, it's a good idea at that point, get the flu shot so that you're not going to, or it'll be way less likely to get the flu and transmit it to others.
Yeah, the transmission of the flu seems like it is a pretty key thing here as far as who you're around and stuff like that, and to transmit it to someone else, especially people you love, seems like almost against the law, isn't it?
That's right, and that's what we tell people. Look, don't just do it for yourself, do it for the people you love. I think that's an extremely important part of the message. You probably have grandparents. If you don't, there's elderly people at your church, as Jacob said, people that you come in contact with every day. Do it for them if you're not doing it for yourself.
When you get the flu shot, when you take the flu shot, you can get it done, I'm assuming today, right?
Today.
Absolutely.
At,
This almost sounds like a commercial.
Oh yeah, Marble City Pharmacy right here in town. And when you take the flu shot, are there other vaccines that you can receive as well?
Yeah, glad you asked that. One of the things that we encourage people to do when they get their flu shot is to ask their pharmacist, am I caught up on the vaccines that are recommended for me at my age with my health conditions, so that you're in the right place? The second most important vaccine besides the flu shot is the pneumococcal pneumonia vaccine, commonly referred to as the pneumonia vaccine. There are actually 2 of them. Once you turn age 65, you have to have 1 dose of each, 1 year apart, not to get too bogged down in the recommendations. But the second most important one is pneumococcal pneumonia vaccine. There are people who are less than 65 who need that as well, so definitely ask about that. Beyond that, there's the shingles vaccine. We've talked on this show before. There is a newer shingles vaccine that's only about 1.5 years old now, that's somewhere around 95% effective. It's fantastic. If you've had the shingles, if you've had friends who have the shingles, you should definitely check that out. The other thing that we talk about in our patients who are over age 65 is the Tdap. Not to get too fancy, but that's tetanus, diphtheria, and pertussis, which is sometimes called whooping cough. Everybody needs to be caught up on their tetanus shot, right? Just in case they step on a rusty nail or other ways to transmit tetanus. But if you're ever around little kids, you need to be protected against whooping cough. That can be very, very dangerous for kids who are less than 5 years old. So just to start with those 4 vaccines, we look at those on people's record when they come in for the flu shot to make sure they're in the right place. So ask your pharmacist, What else do I need now that I'm here from a flu shot?
Jacob, how do these vaccines interact with each other? Any dangers or anything like that?
It surprises most people to find out you can sit there and we can give you all these, in one sitting. Now, is your more needle sticks? Is your arm more sore the next day? Yeah, sure. But it's either that or have it a little sore lots of different times when you come in, or worse yet, choose not to come back and get your vaccines. And so, we give 2, 3, 4 vaccines at a time relatively commonly. I mean, people don't realize, think about it, when you take your 6-month, a year-old into the pediatrician's office, they're getting multiple vaccines right then all the time. But then as adults, hey, wait a minute, can I get vaccines? We do it to kids. Yeah, you can definitely get multiple vaccines at once. And that is the best way to do it, just because people forget or you don't make it a priority. When you're in, getting one vaccine is the best time to look at your record and get all the ones you need at the time.
And especially for older Americans, we've got an older population here in our community, and certainly with the flu season upon us, it's a great time to get those other vaccines as well, and you can get it in the privacy of Marble City Pharmacy.
Absolutely. Got a private room. Nobody has to see your deltoid muscle right here if you want to keep that private.
Nobody will see you crying or anything like that?
Nobody will see you crying. They might can hear you scream, though.
Just depends. Right? Just depends.
Thank you both for coming in this morning. Before we go, seasons are changing. You got the fall stuff out in the gift shop, too.
Oh, it looks great. Beth and Tracy have done a great job up there. If you haven't come in yet, if you've known Beth for years and haven't met Tracy yet, Tracy's helping Beth out. They've done a wonderful job. It's way beyond anything Jared or I could do up there. We're not allowed to touch anything up there. We'll break something.
Got your Auburn, Alabama stuff now.
Got Auburn,
too.
Alabama stuff in.
Yeah,
it's football season, so come check out what the girls have put out there. It looks wonderful.
All right, sounds good. Jacob and Jared from Marble City Pharmacy, our guests this morning, and it's flu season. Is there a website that they can go to, you guys, or any other social media that they can find out more, or can they just come in?
Oh yeah, sure. Come in. Look, first of all, a fantastic website for flu shot information would be cdc.gov. That's the Centers for Disease Control. I mess that one up every time. cdc.gov. There is information on our Facebook page, and of course, you can always call or come in.
All right, we'll see you today at Marble City Pharmacy. Get that flu shot and other vaccines this week from Jacob and Jared at Marble City Pharmacy. More Daybreak after this.